Hello, and welcome to Pointe Orthopaedics. I'm Dr. Dan Aldrich. Along with my partner, Dr. Craig Duhan, we make up Pointe Orthopaedics and Sports Medicine. We have been serving the orthopedic needs of the Lake Ray Hubbard community for over 20 years.
He gave me the confidence because I knew if he was straightforward with me now, he was telling me the truth. He wasn't just trying to make me feel better or get my hopes up. And, he said, we got to have the MRI, let's see it. And once he saw it, and said, it's a bad break, but it's possible we can get you back. And, he kept telling me, I can't rush. The worst, once I have through the surgery, the biggest problem could have been me pushing too much. And so he kind of kept reminding me about that and kept me on track. But, Dr. Aldrich gave me that confidence.
She, knew of his reputation, and she said we need to try to get Dr. Duhan. They said when first going into it that it's probably going to be about an hour-long procedure. I was in surgery for 3 hours, and that's because he was so thorough. Wanted to make sure he had it done right, which once I heard that, it made me feel a lot better, laying there once I come out and, seeing the job, or was told about the job that he'd done. I felt better that it wasn't just somebody going through the motion, hurrying up, getting done, that he was, thorough, and he was looking out for my interest.
Recovery was very good. I had a short stay at the hospital, but I think about almost 3 days. Then I came home for a month's worth of therapy and recuperating and learning how to take care of myself. It all went fine. I followed Dr. Aldrich's instructions. I was a very good girl, and at this time, 3 years later, I'm fully functioning, and I feel really good. And most days, I don't even remember I've had surgery. Most days, there's nothing to remind me of that. And this was a very extensive operation for a total knee, reconstruction.
Here at Pointe Orthopaedics, we treat a variety of orthopedic conditions. These range from simple strains and sprains to severe orthopedic trauma and joint injuries. We treat the majority of our patients with non-operative measures, including bracing, injections, and physical therapy. When surgical intervention is necessary, we use the latest advanced, minimally invasive techniques to allow faster recovery and return to function. Some of the orthopedic conditions we treat include simple strains and sprains, as well as joint injuries such as rotator cuff injuries of the shoulder and meniscal and ACL tears of the knee. We also treat arthritic conditions and perform joint replacements of the knee, hip, and shoulder.
Some people tend to exaggerate, but I give it a 10. It just from start to finish, like I said, with the doctor, the surgery, with the rehab, it's been top notch for me, and I couldn't be more pleased with my experience here.
The surgery went great. It changed my life. I had pain for years. Shortly after the surgery, there was no pain. It's just, it's an incredible thing. I wish I'd done it sooner.
I had a left hip replacement total. I probably had been in pain for about 2 years, and right now I'm about a month out of post-op surgery. No pain, swelling in the hip is down. Great job by Dr. Aldrich and Ruben. Totally great job.
Here at Pointe Orthopaedics, we strive to identify patient goals and work with them to achieve them. Patients come to us in pain, disabled, unable to live their lives the way they want to. It is extremely satisfying for us here to see them return to their life happy and healthy and pain-free.